I am Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we're going to talk about back pain stretches. So we are getting a lot of emails, comments about just having overall stiffness. Everyone's moving less right now, so you're winding up being more stiff. There's a lot of working from home, which does not lend itself to great ergonomic position. A lot of you don't have the at-home workstations that you need in order to be able to sit correctly. So you're winding up with neck pain, back pain, even some numbness and tingling. So we're going to go over some things tonight that you can do in sitting and then when in standing to kind of relieve some of that low back stiffness. The reason your back gets stiff when you sit too long is your muscles are basically, they act as pumps and they allow fluid to come in and then they push it out and they bring it in and they push it out. The only way this happens is if you are moving. So when it's like a car engine, when it stops moving and there's no more oil in the engine, it seizes up. Well, your muscles start to seize up as there's not a whole lot of fluid going in and out because you're moving less. So you start to get that pain, you start to get that ache, the stiffness. And this is where it can turn into a spasm, it can turn into some chronic pain, and even in some numbness and tingling when it gets really severe and starts to affect the disc. So you want to be careful and not kind of ignore that stiffness or that lower back ache and just kind of blow it off, because it can develop into something much worse. So we're going to go over just a couple things tonight that you can do, just really sitting in your chair, and then one when you go to stand up that'll actually help make it easier to stand up. So the first one we're going to do is you're just going to do a figure 4 stretch. Now a lot of people have trouble these days even getting their foot up over onto their knee. All right, hold it wherever you need to hold it. Okay, try not to be down here. You want to make sure that you're sitting upright, nice and easy, and that your ankle is somewhat over your knee. If you have to hold it there just to let it go, or just to let it sit there, that's totally fine. All right, if you're able just to bring it up and let it go, that's fine too. Now this is a good enough stretch. So some of you, especially if you haven't done anything in a while, may feel this to be a good stretch. If you don't feel anything, you can sit up nice and straight and then lean forward. All right, you're gonna start to feel a stretch in your low back, in your glutes, in your hamstring, depending on which area is tightest. That's when you're gonna start to feel that stretch. So the minute you feel that stretch, you wanna stop. You don't wanna continue to push, because you're going to risk injury. So the minute you start to feel that stretch, you just want to stop, okay, nice and easy, and then back off. You want to hold that 30 seconds. You want to do about 6 of those. Now, for those of you who are sitting most of the day, and you just want to sit with your leg crossed like this, that's totally fine. You don't have to necessarily turn it into a stretch. Just changing your position, every couple minutes is going to help alleviate that back pain. So you don't have to necessarily turn this into a stretch where you lean forward. You can just sit like this, and that's going to help open up your hips. It's going to help open up your back. It's going to make you feel better overall. If you haven't done this in a while, you're going to feel maybe some twinge as you lift your leg up. You might hear some popping, some cracking. That's normal when you start to loosen up your hip joint, when you start to loosen up that back. So this is the first one, and then you want to switch. Now, I'll give you kind of a quick and dirty way to figure out if you're having, if your pain's coming from your back or your hip. If one leg is up like this and the other leg's able to go straight, there's something wrong in your hip joint. So just to there's a lot of people that have one leg that can go all the way down, and one leg where they just can't even lower it anymore. It's a really just kind of quick and dirty way to see if there's something going on one side of your body versus the other. Now, what is causing that pain is a whole other story, but we get a lot of people asking, is my hip, is my back? I don't know. It's very easy, to figure out whether there's a hip issue there. Just do that quick test where you test this side and then you test this side to see if there's an asymmetry, to see if they're different. And if they are, then you know there's a problem. Again, not sure what it is. Could be a hip capsule, could be a muscle, but it's an indication that something's going wrong. The second thing you're going to want to do is just a simple hamstring stretch. So you want to straighten, you want to sit on the edge of your chair, okay, and straighten your leg out as far as you can. You want to bring your toes up towards your nose. Now this may be enough of a stretch. All right, now if you get numbness or tingling down into your feet, you want to not do this, okay? Don't bring your toes back as far. So if you're able to sit here and feel a little stretch, that's fine. If you don't feel a stretch and you don't have numbness and tingling, start to bring your toes up towards your nose. You want to keep your knee locked or just slightly bent, not all the way bent. You're not going to feel anything if it's really bent. All right, so you don't need to lock it completely out, but you do want to make sure that it is straight enough that you're going to feel a nice stretch. Now, if you don't feel anything and you're sitting like this, that's fine. You want to sit up nice and straight and lean forward. You're going to feel a stretch going up the back of your leg. What you don't want to do is this, and try and touch your toe. You're putting a lot of pressure on your back, you're putting a lot of pressure on your disc. So you want to sit up nice and straight and then just hinge from the hip and then try and reach that toe. You are probably not going to be able to reach that toe, especially doing it in sitting. But this is a really easy way to loosen up those hamstrings when you're stuck or you're just sitting on a call. What you want to also make sure that you're doing is you want to get up. You don't have to get up for 5 minutes. You don't have to get up and go make yourself a snack. Even if you stand up for a minute, it's going to help get some of that blood back into those muscles. It's going to help that seizing of those muscles. So you're not going to be as tight. You're not going to be going into spasm. So any little thing you can do like that is really going to help. But you want to hold this stretch, the same thing, 30-second hold 6 times. But you can sit here like this for a while if you want. If you just feel better having your legs stretched out, sitting on the edge of your chair, that's totally fine. You want to make sure that you're comfortable if you're doing a stretch for a longer period of time. You don't want to feel that stretch for a few minutes or something. You just want to make sure that if this is how you're sitting, that's fine. Sitting like this, and I'll show you something another quick tip. Sitting with your leg under your chair like this is actually going to pull your back into proper posture. So a lot of people always try and sit like this. Without the proper chair, and a lot of you are working from home now, so you don't have the proper chair. Without the proper chair, it's really hard to sit like this all day. Your back gets tired, your shoulders get tired. All you have to do is drop one leg down. It actually will pull your pelvis forward and allow you to work with a straight back. So one leg stays flat and the other one drops down and under. So you'll be pulled forward and you'll be able to sit up nice and straight and not have to work so hard to do it. The last stretch I'm going to show you is just kind of when you stand up. It's just more of a, I don't even want to call it a stretch, it's just more of a stretch out, if you will. So when you go to stand up, all you're going to do is you just want to arch your back a little bit and then roll to a stand. And you want to do that a couple times. A lot of people stand right up, they feel sore, and they're like, ah, and then they just kind of push through it. If you take just a minute or two to just roll your spine out nice and easy, all right, so you're just going to tuck under and then back, and then under and then back. So basically you're just kind of tucking under and moving back. If you do that a couple times and allow the fluid to gently get back into those muscles, you're going to be able just to stand right up then and walk. A lot of people make the mistake of just standing up and pushing right through the pain and maybe limping a little bit, moving a little bit slower. But if you take that 30 seconds, minute, whatever you do, just to kind of arch the back and curve the back, you're going to find that you're able to move a lot easier, a lot quicker, and with less pain. If you do have back pain or know someone who is experiencing back pain and stiffness and you want a free consultation with a physical therapist, all you have to do is call our office at 215-997-98 and we'll be sure to get you in. Thanks and have a good night.